Hardin Children's Medical Center, providing comprehensive pediatric care for Arizona's families.
If it was my child, my family member that's a pediatric patient, I would want them to go to a pediatric ER because they're going to understand children.
Children aren't just small adults. They're much more than just that. A matter of dealing with the child, dealing with the parents, and many times dealing with the grandparents.
Most of the time, if we can, we would like to bring a child to a pediatric hospital. Certain severe emergencies, we may not. We may just want to get to the closest hospital, try and stabilize. But anything else, we would try everything we could to get to a pediatric hospital.
It might be a little bit different group of medications that are given to the children than what you would do with an adult. Knowing when is proper time to do emergency maneuvers, such as putting in an air tube to breathe for them, sometimes will make a big difference in terms of a pediatric trained person versus an adult trained person.
And they're going to be able to pick up on things and provide procedures or interventions that they might need in a more efficient way than an adult-based hospital would be able to.
More important things that are absolutely necessary to come to an emergency department, probably the number one thing is anything dealing with the airway. If you have a child, you have something caught in the airway or just not breathing correctly, that definitely needs to be addressed quickly, and the emergency room is usually your best option. Another one is anything to do with the breathing. If it's very mild, you probably should call your pediatrician first. If that's not readily available, then a quick trip to the emergency department can be very helpful. Any problems with the circulation, and that can be from severe dehydration to someone who's lost a lot of blood. And this all goes back to what you learn in CPR classes about ABCs. And then the next thing would be any kind of disability or deformity, and with that would be broken bones, or bones that look crooked, or should I say extremities that look crooked, would be something that usually is not able to be handled in your doctor's office.
It's important to know a child's medical history, if they've ever had any cardiac history, any surgeries or previous hospitalizations. We're also going to be asking about medications that they might be taking on a regular basis at home, or if you've given them anything that day. It's important for us to know if you've given them Tylenol or ibuprofen or anything like that. It's
a matter of trying to get a history the best you can from the parent, who may or may not have witnessed an injury or may have been at work all day when they got injured at daycare and the daycare person's not here. I usually start with even a 2-year-old. I'll ask them what's wrong. I'll try to get them to tell me what's going on first. And sometimes the parents are quite surprised by what answer that the child will give us.
We have different things, things called a wee light. It helps illuminate the veins underneath an infant to toddler's hand. You know, they're a little more fluffy than adults might be, so it helps us see the veins that we can't necessarily feel in that age. We have something called the J-tip. It's an air-injected lidocaine needleless, and it helps numb for the IV insertion. So when we select a vein that we want to use, we just make a little mark with it, and that helps numb for the IV poke. We also have something called the Freezy spray. It's like an icy spray. It numbs kind of like the J-tip. We have a vein that we selected to use, and we spray it on, and it helps numb like ice. We have that for venipuncture as well. And then we also have, it's a vein finder. It helps us with patients that we're having a hard time getting an IV on. And it helps illuminate veins that we normally wouldn't be able to see or feel.
Sometimes you can take care of real simple injuries without any medicines just by distracting them long enough to do a real simple procedure. A lot of people have a little bunny rabbit stuck to their stethoscope or something like that. I frequently kneel on the floor to get at their level, and particularly with the smaller children, it helps instead of having a man standing over the top of them. I also do a birdie whistle, which can help sometimes. They're scared, they're screaming. Sometimes a birdie whistle will distract them long enough that you can actually hear their heart beating. And all kinds of different pitches and stuff. I've had left many a room where I have a 2- or 3-year-old looking for the birdie.
Our focus will be to get that your child to the right hospital, whether it's a pediatric hospital, if that's what we can make it to. If that's too far, we will take it to the closest, but we're going to make sure your child is stabilized and getting the best care it can.
I make sure that my patients, as well as their parents, grandparents, whoever's with them, are all on the same page, that they're all understanding what the plan of care is, and that they're comfortable, and that I'm, answering any questions or meeting any needs that they might have while they're here.